My name is Craig Hofmeister. I'm a clinical investigator at Emory University at the Winship Cancer Center, and I'm here to talk about abstract that I'll be presenting tomorrow about a trial of an influenza vaccine given in a randomized way to 165 patients here at Emory in 2019 and 2020. The question really is whether we can improve on a single influenza vaccination that we normally would give patients at the beginning of the flu season and is supposed to last for the entire flu season. Unfortunately, myeloma patients generally, if they do respond, that response is only temporary, and by the end of the flu season, they're no longer covered for the entire flu season. So this trial was to see whether we could give a flu shot at the beginning of the flu season, 2 months later, and 2 months after that. 3 shots, when the normal is to give just a single vaccine. Now, the vast majority of myeloma patients have an average age of diagnosis of 70 years old, so 70 years old or older, and hence they normally get a high-dose flu vaccine. So we're giving 3 high-dose flu vaccines in this trial versus 1. The trial took a number of years to get all the laboratory data, and when it came back, it showed that 3 vaccines more than doubled the chances that patients would be protected against the flu by the end of the flu season with 3 vaccines compared to 1. 90% of the patients that we enrolled had multiple myeloma. Some of them were on multi-drug treatment, some of them were taking Revlimid maintenance, and some of them were just on observation. What we did find is that daratumumab suppressed the ability for those patients who had a single vaccine to mount a response against influenza. Patients that were greater than 70 years old, they also had a tough time mounting a good response to a single vaccine. But if they got 3 vaccines, even the suppressive effect of daratumumab nor their age was able to stop them from being fully protected against the flu. The conclusion for the abstract is that in our 165 patient study, we think that patients are best protected if they can get 3 flu shots spread across the entire flu season, and that will be better and provide more protection against influenza and pneumonia than getting a single vaccine. Generally, if you get poked with a vaccine more than once, you're going to complain about it more than once. But other than some mild skin irritation, vaccine-related complications, there wasn't much difference between the 2 arms.